The surgery, there are different techniques involved. First of all, there are total replacements, there are partial replacements, there are other things with a hip called hip resurfacing surgeries, and there are different techniques such as minimally invasive surgery. Total hip replacement refers to a surgery where the entire hip joint, ball and socket, are being redone. So you'll see here what the implants look like. There's a metal stem there that is inserted into the upper part of the thigh bone, which is called the femur. And there's a metal socket piece that's inserted into the opening in the pelvis, which is for the socket opening called the acetabulum. And then there's typically a piece of plastic that's placed inside that socket piece, and then that ball piece that is either made out of usually metal or more commonly these days a ceramic substance. And when you put it all together and you take an x-ray, it looks sort of like that. This is not something that can be done through arthroscopic surgery, but this slide shows that a minimally invasive approach has changed the size of the incision dramatically over the course of even just the last maybe 10 years. The instruments have been improved, and we are now able to do the surgery through a fairly small incision that would be outlined by that blue line you see. It is important to point out, though, that the incision will be as big as it needs to be so that we can accomplish the surgery safely, and of course as small as it can be. It is possible that these smaller incisions will make the rehabilitation slightly shorter than they once were, but it should be pointed out that the minimally invasive surgery has not been proven to show improved overall outcomes eventually.